The excitement continues in the mainstream about Ozempic and the weight loss plans that they're offering all over the place. Am I against it? I'm not fully against it. I think there are people who can benefit from that, but the problem is many are suffering some side effects. One of those is a slow intestinal tract, which is constipation. Some even goes into gastroparesis, which means a really stopping of that. Vital Planet is a wonderful company who's trained me on what do we do to help people who have some of these side effects. Their Vitalax, their Vital Fiber, their probiotic for constipation, and then for those who are getting off of the Ozempic type of drug, semaglutide, Arcomansia is a probiotic that helps mimic some of that insulin potentiating effect. So this is the program if you're struggling, you're feeling bad, or you're getting off of it and you want to optimize your body. But you know, here's the truth about Ozempic and semaglutide drugs. Since about 1964 to 2009, there's been 25 pharmaceutical anti-obesity drugs removed from the market. Well, this new class of drugs does seem to be more effective, but it also has a similar list of side effects. And you know that about 40% of the people are on these drugs quit after 12 weeks. It's also, when they do stop it, if it does work extremely well, they will gain the weight back if they don't put a plan of action together. And that plan differs among a lot of people, but one of which I think is absolute is maintaining higher levels of protein. 1 gram of protein per pound of body weight on the plan or off of the Ozempic plan helps you to, if you're going to lose the weight, lose more fat than muscle. If you're not on protein, you're going to lose a lot of muscle along with the fat. And then almost everybody starts regaining weight after a period of time being off of the drug. Usually within 5 months, they're gaining back at a pretty good rate. And you know, the side effects of the drug means that if you want to maintain that low weight, you'd have to stay on it for year after year after year. And you know, the goal of taking a drug like that is not to have a skinny casket. It's to live a real life that you can feel worthy, feel good, and it all has to do with insulin. We're trying to, in lifestyle, in my world, I focus constantly on how do we make your insulin the most healthy and most potent for not only weight, but for your metabolic health, your disease prevention, the way you feel, muscles, because one of the big metrics for how we age and how we die is the balance between weakness and strength. The weaker you are as we age, the more likely you will die an early death. That even beats the smoking risk. That beats blood pressure risk. And the second is, of course, VO2 max, which is the lung capacity. Lung capacity has a 400% increase in mortality. Smoking is a 50%. So you can see how much power it is in lifestyle and exercise and maintaining the right nutrients and protein. So there's the primer on what do you do if you're on those drugs and you want to be okay on it, and if you're having side effects, some of these programs can be very helpful. Check with your doctor if you're on a lot of medications. And secondly, if you're off of the drug and you want to try to put together a plan, this is a simple one. We certainly have more ability to counsel with you. You can make appointments with our wonderful pharmacist, Dr. Kurt Deering, or myself, or Adam Chauncey, as far as putting together a fitness plan that will make your future not only look better, but feel better and be healthier. Thank you.